Dr. Shelly, and I'm so excited because this video is for LPNs only by popular demand and very, very, very popular request. I am giving you a video that is specifically geared for the LPN trying to take their NCLEX exam. In this video, LPNs only, 10 tips on how to pass the NGN NCLEX for LPNs. You will learn what you should focus on and what you should not do and what you don't have to worry about on this test. Now, let me start by saying the LPN preparing to take this NCLEX exam has to do, number one, they do have to know that the body doesn't change based on your licensure. The condition of pancreatitis, a patient coming in with chest pain having an MI, a maternity patient with placenta previa, a pediatric patient who's not sitting up by 8 months. They're not going to look any different if you are taking an RN exam or an LPN exam. So I say that because sometimes I get this request from LPNs, do you have an LPN review course? I say, no, I have a nursing review course because the human body didn't change because you're taking an LPN exam. Everything is still the same. I'm not going to use different medications because you're an LPN to take care of pneumonia. I'm not going to have a different procedure preparing a patient for a colonoscopy because you're an LPN. I'm not going to have any different regimen for the patient going into shock just because you're an LPN. So that's the first point I'm going to make. Make sure you understand that basically nothing has changed in terms of the human body. And to put that in perspective, I have often had 2 students who just passed their NCLEX exam, LPN, RN, and this LPN and this RN, they took 2 different tests, but when they got in this room and started having fun with the students and talking about their experience, they were so shocked to know they had the same exact questions. They had the same EKGs. I mean, it's really crazy. So just know that, all right? Now, number 2 of my 10 tips on how to pass the NGN NCLEX, number 2, remember, LPNs reinforce instruction, not teach. So LPNs are reinforcing education supposedly done by the RN first. You and I both know it's all bullshit because the LPN does everything, a lot of everything the RN does, and sometimes does it better. In fact, in my department, the best people at the job are the LPNs, especially when it comes to being at the head of the bed, helping the doctor with the scopes. And so I was trained by LPNs. And what was so wonderful is that I was trained by an LPN who was in my class 12 years ago. So I'm saying that to say this reinforcing teaching or reinforcing instruction is the actual language on NCLEX, and you don't want to choose language that says teach because that's part of the nursing process. So be careful. If it doesn't say reinforce, don't click on it. Next, my third tip of 10 tips on how to pass the NGN NCLEX. Remember that LPNs perform data collection and validation instead of assessing because, again, assessment is part of the nursing process. It's stupid, I know, but it's a language. You got to know it. It's on the test. I don't want you to fail. Just pick it up and run with it, okay? So here's what we're doing. This data collection is supposed to aid the RN in her assessment of the patient. We again know that that's ideal and bullshit at most times, but you are trying to pass an NCLEX. Here we go. LPNs coordinate care, which means the same damn thing as management of care. So here's what I'm saying. Clearly, we don't have language that says the LPN has management of care. That's an RN role, supposedly. However, when you look at the questions on NCLEX, under the test plan, coordination of care, which is the language you will see on your CPR report if you ever failed your LPN exam. At the very top, about 20% of your test was called coordination of care. That is the exact same thing as management of care. In other words, the RN on their CPR report has management of care. This type of process on NCLEX, this part of the test plan on your NCLEX exam, has to do with delegation, prioritization, case management, like preparing the patient for palliative care or hospice care. It has to do with HIPAA, and it has to do with confidentiality, patient advocacy, autonomy, justice, fidelity, beneficence, non-maleficence, veracity, all those ethical legal terms. It has to do with malpractice and torts and negligence and SBAR and workplace violence and workplace conflict and all of these things, therapeutic communication, you name it, it's got to do with it. And so it's confusing because it's not called the same thing on your CPR report. It's called coordination of care, but it really is management of care. And I have a playlist dedicated to management of care. Next of the 10 tips on how to pass this NGN NCLEX for LPNs. LPNs do delegate. They delegate a lot, and they delegate to unlicensed assistive personnel. So I want to show you, because part of what I'm excited about is having an LPN study bundle. And when it comes to this, I want to show you some areas of the Oh My God packet. So you know the Oh My God packet is a big hairy deal. It's your study guide for how to pass. I want to show you a section on here so that you see the nursing process terms. Avoid delegating the nursing process. The LPN is not supposed to be doing the nursing process. So that is on page 8 of your Oh My God packet. I also want to show you some things where you would be delegating to the UAP. So you may see delegate to the UAP, and you should see when you look here, all of the things that you can delegate to the UAP. And I'll just read some things to help you remember on the test. Remember to delegate to the UAP: report, remind, record, AccuChecks, enemas, topicals, and stable patients, even bladder scans. So that is something that the LPN is absolutely within their scope to delegate. And that's important because I think a lot of times LPNs feel like they're getting delegated to. They don't really understand how they're responsible for delegating as well. Okay, so that's the first half. Now for the second half. Here we go. Number 6 of 10 tips on how to pass the NGN NCLEX LPN. Focus on all generic meds. I'm not sure why, but it's come across my attention that a lot of these programs, these nursing programs, are giving you brand names of medications like Coumadin, like Librium, like all these like regular freaking brand name drugs, and you'll never have to see on NCLEX a brand name. There's no Tylenol on NCLEX. There is no Advil or Aleve or ibuprofen, or ibuprofen is on NCLEX, but there's no Advil or Aleve. There is none of that. It's all generic, and it sucks so bad, but you've got to know your generics. Now, you don't have to really focus on generic meds per se, but you do have to know your classifications. And what I've done and prepared for you is the 2024 medication categories. This is part of the LPN study bundle that I told you about, that I'm packaging just for LPNs. And that is really all you need. You don't need the list of these meds will be on the test. No, that's stupid. It's the categories, okay? So there you go. Now, specific areas on NCLEX to focus on, to give all your love and attention to, is going to include, and these are where we call it the white packets. Here we go: psych, geriatrics, growth and development, maternity, pediatrics, and diabetes. So what did I say? Let's make sure we get our shit together here. Here we go. We have psych in the LPN bundle. We have geriatrics, and specifically you're responsible for knowing the changes in patients who are 65 and older. And then, of course, we have our growth and development, and this is where you have to know a lot of the well child care. So you have to know those developmental milestones, what children should be doing, because a lot of times you work in the ambulatory setting with pediatric clinics. Here's your maternity, because many LPNs don't understand that they actually have to know quite a bit about maternity, and they don't get a lot in school, so that's part of your bundle, your LPN bundle. And then, of course, you have your pediatrics. And then you have, you knew it, you knew you were going to see this packet, because what do LPNs do in the majority of cases? They take care of a lot of diabetic patients. So patients with diabetes are a big focus on this test, and those are all in the LPN bundle. You need to buy UWorld RN, not LPN. I'm sorry, guys, but Archer is too easy. UWorld LPN is too easy. You need the RN version. And one of the reasons you need the RN version is because the LPN version doesn't even have EKGs, and EKGs are on your test. In fact, every EKG I've ever had done in an ambulatory setting once a year with my primary care has been done by the LPN. Just saying. In many emergency rooms, it's the LPN that's doing the EKG. So I need you to buy UWorld RN, not LPN. Generally, you're going to use 90 days. I know there's boot camp. I know there's RN Mastery. I know there's Archer. They are not adequate to prepare you for this NCLEX exam. And that's me talking here. I have the PhD. I've done the studies. I've looked at all the software. I've answered all their questions, and UWorld prepares you the best. And that's just facts, ladies and gentlemen. And I'm trying to keep it real with you. I know it's a little bit more expensive, but go out there and do a little something strange for some change, something funny for some money, get some cash in a rash kind of way, and you'll be fine. Know your basic care and comfort and reduction of risk, as well as infectious diseases. These are some of the test plan components on the LPN exam, and they can be overlooked if you're not careful. So what, of course, I have done, because your girl knows how to prepare you, I have made for the LPN bundle your reduction of risk right there. Procedures and reduction of risk. This packet has your basic care and comfort right in it. And then, of course, we have our packet for infectious diseases. It has the airborne, the contact, the droplet, all that good stuff right in here. And this is included in your bundle, in your LPN bundle. And then because 75% of the medications on NCLEX are psych meds, I even prepared you with the psych medications packet in your LPN bundle. And then let me say this, I know you went to school for 9 months a year, maybe 10 months, whatever, but let me help you with this. It's going to take about 12 weeks to prepare for the NCLEX exam, because you've got to study content and do questions. You've got to do your UWorld NCLEX type questions, but you also have to know content. So you have to take notes on so many of the different videos that we have that are free on YouTube. Now, everybody out there is doing videos, and some of them are really good, if not even better than mine. But one feature that my videos have that others don't, that I think you will like and appreciate. Number one, I put my entire nursing school on NCLEX for free. No one has done that. So there's over 600 videos at your disposal for no cost. But I also organized it in the form of playlists. So if you go to my playlist, you can pull up anything. You can pull up basic care and comfort. You can pull up reduction of risk. You can pull up the NGN test plan. You can pull up cardio. You can pull up cancer. You can pull up maternity and ortho and burns and critical care and GI and neuro and everything by system or disease process. Geriatrics has their own videos. There's the Alzheimer's and everything else. And you can do that, especially when it comes to psych, because psych is a lot. And you have to know alcohol and substance abuse and eating disorders and schizophrenia and bipolar and OCD and all of this stuff that you have to know. And I would say again, I don't know why I said that, but maybe it's because psych is a big focus of your NCLEX exam. So that's how easy it is to pull up my videos. Now, let me remind you again what we're doing because I am excited. I'm not going to lie to you. This is like a big hairy deal because so many LPNs say, well, you know, what exactly do I have to know? And yeah, you kind of got to fucking know everything the RN knows. In fact, let me just say this while I'm got your attention. The LPN often works in areas where an RN or a doctor is not available. And by that, I mean, picture yourself on a weekend working in long-term nursing care with 32 patients and aides. There's no RN, there is no physician, there is no one there other than you and a few nursing assistants to take care of this massive amount of patients. And there you are having to use your incredible skills to know when to send a patient out, when to call the doctor, when to just treat the patient with some of your nursing interventions. You got to do all that for all those patients. And it's really hard because there's no one to call. Typically, you're by yourself, okay? Especially on night shift. All right, so let me show you what I got because I think you might actually love it. I know I think it's very beneficial knowing what I know about nurses taking this exam. So here we go. You ready? Are you ready to know what the bundle is? Well, the bundle is 6 pink packets and 6 white packets. So you have the Oh My God packet, which is your study guide. It has everything in here. All the delegation, all the prioritization, every bit about who you see first, when should you call the doctor, everything. It's got your ethical legal terms. It's got your pediatric and maternity quickies. It's even got pathophysiology and all your precautions in there. It talks about infectious diseases and diarrhea, and it talks about immunosuppression. It even has diets and nutrition and positions in there. It's got your test plan for NCLEX in there. It's got the case studies and how to answer them in there. Everything. It's a big time study guide, okay? All right, and then it even has the list of subjects you should tackle and what order you should tackle them in. Now, procedures and reduction of risk. This is your basic care and comfort and reduction of risk packet. It has all procedures in there. Canes, crutches, walkers, Foleys, NG tube feedings, inserting IVs, how to make an ice pack, what's a sitz bath, what about the patient with a colposcopy versus the patient with a colonostomy? How about the patient who needs an injection that is a BMI greater than 27? What about your body mechanics? How about the proper positioning for certain procedures? What about how to mix insulin? How about your ventilators? What about trach care? How about your infiltration, your extravasation, and your phlebitis? What's the difference? How do I know? I mean, everything is in there. You know, everything. This says management of care, but it is also coordination of care, or 20% of your NCLEX. Here's your infectious diseases. You saw me show you that earlier. Here is your medication categories. We talked about that earlier, and the mighty all psych meds that you gotta know. Of course, that's part of the LPN bundle as well. And then we get to the nitty gritty where you are immersed in actual topics that are big on the LPN test. These are the 6 white packets. So here we go. We have psych, we have geriatrics, all right? We have pediatrics. We also have maternity. We have growth and development. And we have your favorite, diabetes. You get all of that, which is a lot, by the way. You get all of that for, ta-da, $209. Unless you pass the quiz that has been uploaded into this HETV site, YouTube site. If you pass that quiz, you get half off, baby. Yeah, you get the LPN bundle for $100. Deuces, I hope you pass. Remember, text 216-410-0936. I gotta go because it's getting close to Christmas.